and how can we serve them better. So we were talking maybe perhaps bring vaccine clinics to their areas. Not every single homeless has access to the clinic, although the clinic offers those services, but perhaps going to the encampments. So by going to where they are, by providing information, and maybe bringing more partners, more clinics, and not only Greater Lawrence, and making ourselves available to provide the vaccines as well, could be a solution. So every Friday they still hold it, every single Friday. So regardless if what we can do from now on, they still hold that vaccination clinic. Not at this moment. We can start one. They do have the police they receive needles, but I don't think they provide in exchange, right? They have sharp. No, but we can start that if that's what the board wants. We still have a contract with the biohazard company that picks up the needles, so we can start that practice if that's what you recommend, just to see. And I think that's the highlight of the conversation here. At one point, a 100 watt. I have to talk to them. I don't know exactly to what point. I want to say yes, because not only they provide, like I said, the clean needles, but they also provide the vaccination and all the resources that they need. Besides, not only for Hep B, but all the communicable diseases that they treat at 100 Water Street. Yes, and I remember that effort. The question probably and the opportunity is to see where we at, what is missing. I think at one point we lost a little bit of connection in bringing containers to the homeless population. But then again, we have the other in question out there. Is it only the homeless or who else? It may be other audience that we have to pay attention to, like those young adults that are there trying drugs, or that's the reality. And so the education, like you mentioned, and what are we gonna do, and who we're gonna bring to the table, like the stakeholders that can provide education and I guess a citywide campaign to address this issue.
Okay, very good. No, I appreciate that, and we'll look for an update at our next meeting. Thank you, Esmelda.
Yep. You're welcome.
Okay, is Pamela Gonell here? Great. Oh, Pamela, we'd love to hear an update on ICE guidance, City of Lawrence.
So as the last meeting with the 14 larger cities that we had, the concern was what is happening with the kids that have been by themselves because of their parents have been some way with the ICE raids. So we are planning to make some communication with the city, letting the people know their rights, what they need to do in order to be safe, let's call it like that. Just a few points that they can do also is they can remain silent. If they are detained, they have the right to contact an attorney, and they can refuse to sign anything without any advice. So I would ask any advice how we can surely communicate with the people so they make sure what their rights are.
Have there been ICE raids in the City of Lawrence up to date?
There have been some of them, but we haven't received any complaints, any concerns to the department.
Okay, but no raids on churches or schools or?
No.
Okay. Okay. Any comments, questions? Okay. Thank you for the update. I think it is of utmost importance to disseminate that information. Those are important guidelines to retain an attorney and to not sign anything. And we have quite a few people with, you know, kind of in limbo. And the worst is when, you know, kids are in school and they have the fear of coming home and their parents not being there. So that we want to avoid at all costs. Difficult situation, as this is an immigrant community and always has been, and that's what brings its strength, not its weakness. Okay, influenza outbreak. Influenza is the #1 infectious disease right now. And there was COVID 2 months ago, but it started dying down. We typically see influenza in the colder months, and right now we just had a nice cold snap. And I mean, I can't tell you, I'm sure Vidal will attest as well that we're seeing a tremendous amount of influenza. I have influenza as right now. I'm sorry, I wouldn't miss the meeting, but it's pretty awful. I know that Pat had influenza recently. It's a really terrible illness. It just gives you fatigue and headache and sore throat and a cough, and you feel miserable. So I can't stress enough the importance of flu vaccine. This year, there was a real decrease in the numbers of flu vaccine that we administered on a citywide level. And it's not for lack of availability. All doctors' offices have them, pharmacies have them, but there's a lot of vaccines these days between RSV and Prevnar and shingles and COVID boosters and influenza. It's dizzying for most people, but flu is a pretty nasty illness, and we really urge our citizens to be vaccinated against the flu. Are you seeing a lot of flu?
I do. And what you're talking about is like you have a lot of vaccines out there. So a lot of people, they're getting scared, so many vaccines, and they are just a little skeptical about to use it or no. So we are supposed to be promoting everybody to let it know how important it is and try to break down that mentality that people have. People, they don't trust much vaccination after COVID. A lot of the Hispanic population, they're afraid of them. So we have to, everybody that have a little bit of knowledge.
You gotta hold it. Push and hold. Put your thumb on it.
Done that. Not working. Okay, thank you. So, like I was saying, so all of us, we should be, a voice out there into the community to try to teach and let it know that how much important it is to get immunizations and let it know that it's safe to have it. So it's gonna help all the community to be in the lower cases of the outbreak that we've been having lately. It's been a lot of patients with influenza right now, like we can see here. Dr. Gong is one of them. So
And I tell you, I think one of the most important things not to overlook is to immunize your children. You know, children are the vehicle that brings COVID home from their daycare, from their school. My little snotty-nosed children, I'm sure, brought it home from daycare and gave it to me. So, I mean, no vaccine is 100%, but it certainly can, decrease the prevalence and decrease the severity of an illness. So we encourage people to get the flu vaccines, including vaccinating their children, starting at age 6 months. Okay? Don't overlook that. Okay. COVID, we don't see a lot of COVID right now, but again, there's still a COVID booster, and it's not too late to get it. Okay, I want to move on to...
In the local hospital, I do see quite a bit of COVID, a lot of influenza A, and as a nurse working in an acute hospital, I have to wear a mask the whole time I'm in the hospital.
Okay, we're going to jump to a quick item, discussion on private versus public workplace smoke consumption. Why don't you tell us what we're doing here?
Several years ago, there was a provision that we passed that is extremely ambiguous. There is a definition of several items, but there isn't a definition of establishment. Based on the Oxford definition, an establishment is a business organization, a public institution, or a household. I feel it is important to define establishment clearly, or as not to infringe upon the private rights of our citizens, residents of Lawrence. As written on the ordinance, it is vague and undefined and will create future problems with enforcement, we as a board have the right to create responsible health regulations for public good. This board power should always measure and should be always measured and principled, especially when potential infringement upon citizens and residents' personal privileges and rights. The way the law reads, we can actually start giving fines for people consuming certain kinds of smoke products in their home. I feel that this is, as a Board of Health, I've been here for 10 years, and it matters who's the mayor, how it's going to be enforced. Referring to or quoting Caesar, definitions are important. Certain words are important. So I want to actually add a definition for establishment. I think we should put a definition or add a definition to this ordinance. I would like definition to be established and referred to any business, organization, or public institution upon the general public subject to MGL C270 S22. So I really want to defend the ability to separate private and public. I do not want to see this city giving fines in the future for people consuming stuff in their private location.
Dr. Guan, may I?
Yes, please.
Let me just ask a question first. So your concern is strictly regarding smoking in private residences?
Private homes, yes.
Private homes, right. So I personally don't have an issue with that. I have a problem with that. So if you want a definition to be added, I'll be glad to devise one, but I have a problem with your definition. I think that we need to look more into what the state law says, what the local regulation says, and find the best definition for the purpose that you have. Basically, you want the word establishment to exclude a private residence.
Private,
We can have a simpler definition that allows the board to continue to work as we have been doing so far. Because my concern is that we could, if we throw this one in, this could create other problems. Like, for example, private clubs, they're not a business in the sense that it's not a for-profit organization. It has to be not-for-profit in order to be entitled, for example, to allow smoking in the members' area. This definition doesn't include that. So if your concern is, I don't want at some point in the future that the city start fining people because they're smoking inside their own private homes, I have no issues with that. But I don't think this definition is adequate, and I think we should think more of what the best definition would be to accomplish the goal. So nobody will ever be fined for smoking in a private residence, unless there's a federal law that applies and say, hey, no, everybody has to adapt to it. But I don't have an issue with that at all, except that I wouldn't jump and adopt this one here tonight, because just my first reading gives me a little bit of a concern, because terms do matter, and there's some terms in the definition that may be further defined and create more problems. So if that's what your concern is, I think we are.
That is one of my concerns. The other concern is the separation between private and public establishments. I think a private establishment should be able to do whatever they wish. We've had this discussion before. You can smoke a cigarette in a private location, but you can't smoke a hookah. I feel that we're demonizing how they're consuming it. Tobacco is tobacco. I feel this board's view on tobacco should be more tiered toward doing more education on people under 21 smoking in regards to creating a division on private, or the clarity between private and public. I feel in the private location, if you are let's take the example of clubs. In a private location, if you are a member and that is what you are signed up to do and those are your by rules, you should be able to do that. Yeah. At the Fireman's Relief Club, you could smoke a cigarette, but you can't consume it in a different way. Tobacco is tobacco. And if that is what you want to do, I feel that you signed up to that place, you have rules, it is not open to the public, and you should be able to consume whatever it is legal in the state of Massachusetts.
All right, so that's a separate issue. So you're bringing up whether, people should be allowed to smoke hookahs in private clubs. I think that's pretty much the gist of it. Smoking in private clubs is regulated by state law. We have to conform to the state law. State law has some rules for when smoking and where smoking can take place at a private club. It's a longer discussion for us to have. For example, smoking in private clubs can only occur at a members-only area. I can go over all the criteria. That members-only area has to be segregated so the smoke doesn't go anywhere else in the club. Portions of the club open to the public has to be smoke-free, properly signed and everything else. So, and that's the whole thing about, whether smoking can take place in the patio. We have local regulation that does cover smoke in the patio. I don't think we can address this here tonight, but I think that's something, I suggest that we put this back on the agenda for further discussion. I just want to remind you for one thing.
We've had several discussions. This is like the third time that we've brought it up. We've always had 2 members. Now we finally have 3 members to actually discuss this. So I feel that we should either go forward or go backwards. This has passed, or this got passed 10 years ago, and they actually kicked me off the board for my opinion. So I do feel strongly about this.
Well, I mean, if the board wants to address this tonight, then I have a list of concerns here about hookah smoking in private clubs, and also about going back on the regulation. Boards of health they have a lot of authority, but the authority is to uphold public health, is to pass reasonable regulations that will advance public health, not advance the financial interest of businesses. It's not your primary concern. Your primary concern has to be what regulation can be passed and adopted that will advance public health in the city of Lawrence. That is your mandate. That's what your authority is. If you want to change a regulation solely because you want businesses to make more money by allowing hookah smoking in private clubs, then your proposal would violate what Chapter 111, Section 31 establishes, that boards of health can pass reasonable public health regulations. And the regulation that relaxes a restriction on smoking, whether it's in private club or any other type of business, it's not a regulation that advances necessarily public health. So it's a longer discussion.
Our job is for common sense. So you could smoke a cigar, but you can't smoke a hookah? Explain to me that rationale. Tobacco is tobacco. I've been in the healthcare field for years and years, and tobacco is tobacco. I don't understand the demonization of this.
All right.
The problem I see is that all these clubs on Broadway are going to become private clubs in their own way, shape, or form, and everybody that walks through the door and pays $1 becomes a member for the night. It's a slippery slope, Steve. I mean, you propose it as we don't want people to be fined for smoking in their house, but what you're really trying to do is make it more lenient for private clubs to smoke hookah. And I'm not totally opposed to that necessarily, but I do want to adhere to the state law. I mean, if we decide as a board to allow private clubs to smoke hookah, which I'm not opposed to, I want to make sure that they're doing it in the proper way. And I also want to make sure that clubs on Lawrence that are just open to the public with people working there are not suddenly becoming private clubs or pretending to be private clubs. The litmus test for being a private club is quite rigid, so I don't know who is really going to be. I mean, if we're talking about the firefighters union or the English club, I mean, I really don't care, but the problem is when all these clubs in Lawrence somehow find a way to have a private section and they're all smoking hookah in the back room because it's their private club. That's going backwards, man. I just don't see that as something that's moving in the right direction. But if a truly private club makes the decision to have a separate section to smoke hookah or cigars or cigarettes in a cordoned off area with proper ventilation and have signage and areas that are non-smoking, yeah, I mean, that's something that I would entertain, absolutely.
So one concern that I think is important to bring up, and I brought this up the first time we discussed this, is that, the moment you say, hey, you can have hookah smoking private clubs, a lot of these private clubs are going to start pretending to be a private club, but they're actually open to to the public. Once they're open to the public, there should be no smoking whatsoever of any kind. Cigarettes, cigars, nothing. It has to be completely smoke-free. So this would probably work against the idea of having smoking in private clubs because, you know, some of these clubs may not operate as private clubs. They're going to start allowing people, members of the general public, to come in. Once a single person from the general public come in into a club without being done that properly, in the members-only section, the whole club has to be smoke-free. No smoking in any other place. So that's another concern that I think
Can you
should
give us
be-
an
When was the
example?
last time you went to a club in Lawrence, Caesar?
I go to private clubs when we have complaints.
When was the last time?
I don't remember.
Thank you. Well, it is very rigid. To actually get a private club, it has to be in a certain zone. There are by rules to actually be a private club. There are certain, when you go into a private club and you bring a member, they have to be signed in. There isn't a control in regards to it. I don't really see a big issue between the vehicle that they consume the tobacco. There is not a lot of places that will fall into zoning that could pass it. I think we can easily control it by talking to licensure to make sure that this does not happen, but I believe we're infringing on the rights of person to consume tobacco. You want to consume tobacco by a cigarette, you want to consume tobacco by a cigar, you want to consume tobacco by a hookah. Culturally, this has been
We have no problem with people consuming tobacco. We just don't want them to do it in public and expose workers.
That's why I'm presenting it that's why I want a clear definition between private and public.
Well, that's been defined, I mean, the way we look at private clubs has been defined by the state law. A private club to be subject to smoking as an exception to the state law, it has to be a not-for-profit organization. The moment these people they allow members of the general public to come in, they start operating like a general business. They're not a non-for-profit organization anymore. So they won't be allowed to have smoking at all. So it's, like you said, you know, yes, for a member to come in with a person, that person needs to be signed in, they have to keep a log and everything else. All of these things, and have, you know, an area that's members only, the smoke is segregated, it doesn't drift into other parts of the club. All of these things are hard to maintain the way they already are. Now, the moment you say, well, we're going to change the regulation, not because we have a health concern, but because we just want to allow people to make more money out of smoking, I don't think we're going in the right direction. We're sending the wrong message, because now the whole public, the whole city is going to come and lobby before the board and say, hey, let's change this other regulation here because, you know, we don't like the way it affects our business. So your mandate is to uphold public health, Stephen, for the whole board. I understand what your concern is, but your concern cannot be addressed by this board without regard for what the state law says, for how private clubs are looked at by the state law. If it is,
Okay.
if it's not in conformity, then...
Let me interrupt because we got to move on. Stephen, I have no problem redefining public and private. I think you guys, I promise you we'll vote on something next time, but you got to work on a definition with Caesar. But I do want you to, you know, I don't know what the ultimate purpose or goal of this is. Is it to, you know, there's not a lot of private clubs in Lawrence. Is this going to create an explosion of private clubs? Suddenly there's no, I don't know. I don't have a problem defining public and private, but what I do want is we have to adhere to the state regulation that governs private institutions regarding tobacco. If we can accomplish those two things and just have a good definition for public, a good definition for private, and make sure that we adhere to the state regulations regarding smoking in private clubs, I have no problem with that.
I
So
can
let-
certainly bring a proposed language for, to remove the risk of we ever issue a fine for somebody because they're smoking in private residences. It probably won't be a definition of private and public, because I think it's a more complicated definition to make, but I can create a definition for establishment that excludes private residences, and that will take care of that.
But it still does not define the definition between public and private. If we only do, I do want to protect the household, but I do believe in choice. I do want to give the people
Let me give you an
liberty and
example.
choice.
Let me give you an example. It could be any type of business. If there's a complaint of smoking, I can go in. It doesn't have to be open to the public. It doesn't have to be like a general business that you think, that people can come in. I can just go in and check, the back rooms, anywhere in the establishment. There should not be smoking at a workplace. That's the state law. So defining public and private, it's a longer discussion. It's a complicated one. I've been doing this a long time. This will be complicated to address because we have to think of all the other repercussions of this. If your concern is you want people to be able to smoke in their own residences, that's easy to fix. We can fix that. I don't have a problem with that at all. The other stuff, I think it's separate, and I think that's, as you know, I have concerns about it.
So what is the current law? Private clubs, I mean, how many are there in Lawrence?
I don't know how many clubs are there right now, but basically, a private club can allow smoking as an exception to the state law.
Okay.
Generally, a workplace has to be smoke-free. Private clubs could come as an exception if they meet a certain criteria.
And that's smoking, can they smoke hookah if they smoke tobacco?
They don't make they don't differentiate what type of tobacco it is. The local regulation makes a distinction between smoking of hookahs and smoking of other tobacco. At that time, the original concerns were that of a spread of disease, people sharing the tips. It was very common for people smoking hookahs, there's two hoses, they're just sharing the hoses, they're sharing the tips, and spreading hepatitis B. That was one concern that I can remember. So that's why there was a distinction made at the local level. At the state level, there's no distinction between, whether the tobacco is smoked at a private club that meet all the criteria, whether it's a hookah or whether it's a cigar or cigarettes. They made no distinction that way.
Dr. Goin, I believe we have approximately 3 private clubs, I think. That's all we have left.
Okay. We gotta move on to our intermunicipal agreement, shared services grant, contract approval. I hope you all had a chance to read through this. So this intermunicipal agreement, or what we know as the Public Health Excellence for Shared Services Grant, has been a long effort to regionalize public health services. There was a study done, a report done in 2019 that made some recommendations to increase local public health capacity through cross-jurisdictional shared services programs and agreements. These excellent for shared services grant comes with a lot of money. And this is an agreement that has been executed between the town of Methuen, the city of Methuen, and the city of Lawrence. It sets up a structure amongst the collaborative participants, being Methuen and Lawrence, and this is supposed to increase local health capacity, utilizing each other's services. One thing that we noticed looking through this, while it is good in terms of setting a structure, there's going to be a program manager that's going to coordinate, manage, and direct the day-to-day operations. They're going to be implementing programs by which the public health staff uses the resources of both municipalities to consolidate services. And I think it's great. The thing where this document, I think, needs work or falls short is there's no what we call scope of work, scope of services. Scope of services really is kind of define what type of services we're talking about that we're going to share. Is it training? Is it learning on-site training? Is it epidemiological assistance in terms of when we have a hepatitis B outbreak? Is there something that we need to bring in an epidemiologist that the communities can share? These are things that were designated by the study in 2019. But I think overall, even though this lacks the scope of services, it definitely is a start. And we've had difficulty getting to this point, but we finally have an agreement between the two communities that is going to move forward from here. Now, it will require this board to appoint certain members to the Shared Services Grant Board, or it's called the Advisory Board. And so it'll be comprised of 7 voting members and 2 alternate members in case there's a member that can't show. So it spells it out very clearly how many get appointed by the city of Methuen. There's also going to be the mayor of each community or the mayor's designee. There's going to be also a chief financial officer from both cities. So this advisory board will design the scope of services that the two communities will share, funded by the state grant. And so this is an exciting development for the city, for both cities. We desperately need more training. Our inspectors are very capable, but again, the food and sanitary code is vast, and it takes a lifetime to learn it well. So our goal for some of this money is to improve training, also employ an epidemiologist, and throughout our advisory board and our appointed members, we will design a scope of services that is appropriate for both communities. I'd like to give the public an opportunity to comment on this shared services grant. Specifically, Ethan Mascoop, I'd love a little comment from you, because you have more background in this than anybody.
Dr. Goin, do you have Exhibit A there? It gives you the scope, right?
I don't have.
Is there a scope? Ms. Mulder?
I'll make
No.
sure you get it.
So there is a scope of
Yeah,
services?
Exhibit A and B, I think it is,
Okay,
yeah.
I got,
Yeah.
B is
It's
one
blank though,
page,
yeah.
one line,
Yeah, no, it's.
and A is nothing, and A is,
Yeah,
there's nothing there.
Yeah, it's, I should have sent it to you, I forgot. I'll
Okay.
make sure everybody gets it.
Okay, great, so there is a scope of services, awesome. Ethan, give us your 2 cents about the shared services grant, and what you see it as accomplishing for both Lawrence and Methuen.
Okay. All right, I'll be very brief. I think, as Dr. Gordon said, I think it's an excellent opportunity, and it's something that's taken quite a while to achieve. I think there's a lot of challenges. There's a lot of challenges for the advisory committee, because for example, in the inner workings between the two departments, it's very, very different. Methuen is in a very different place than Lawrence in terms of what they do and how they do it. Very, very briefly, for example, here in Lawrence, there are things that the city should be inspecting. They have not. There's been a history of not. For example, summer camps, the indoor skating rink for air quality, which is mandated by law. Methuen is achieving many of those similar things. So there's areas where you can learn from, let's say, Methuen that you're not doing here in Lawrence, and that's a good thing. I think, however, what's very, very important here is that to really do in-field training, that's critical. And the state's not providing that. The state's going to provide, if you want, the state's providing online training, remote training, remote advice, and remote assistance, but they're not doing in-house and in-the-field training. And I think with your staff here, that's really critical. I really believe that. And as I look at the agreement, by the way, it's interesting here where it says each municipality will consent to the collaborative's duly authorized agents and representatives in exercising its function. And I'm here also to inform the board that, for example, this past month I have not been here in Lawrence. I've not been invited to be here, and yet I need to fulfill my obligation for the shared services. I'm still under a contract with Methuen, and I'm happy to do the training. And I'm available to do that training. And in fact, I'm still doing that. I'm now doing it for another shared services region in Massachusetts. And in fact, I'm acting as an interim health director for the town of Millis, which is much smaller than Lawrence. but right now, where their director is away on leave, I'm in his place. And where I'm also participating in their shared services. So my suggestion too is that and beyond the training, there's a lot of good challenges that are now, since you have the funding, there's a lot of good opportunities. And I would say, looking at it in two parts. One is your core requirements, the state sanitary code, food, housing. Housing is critical, and housing is not going away. It is critical. And I would suggest that, and there's a lot that can be done with that, and also with food. Other things, I said, summer camps or day programs for children. That comes under the Board of Health, skating rinks, swimming pools, and other activities. But also there's possibilities here to really tackle problems that address this community. So, for example, a primary employment opportunity for most people, for a lot of folks here, is hair salons. And there we know public health. We know from the public health data and research, phthalates, which are commonly found in hair products and nail products. The folks that are working in it are very much exposed to these hazards and these contaminants. But we can work with them, let's say with the shared services and additional support, and help them reduce their exposure and do more proper handling of these very hazardous products, and still stay in business and do business in a way that's actually better for the customers as well as better for the workers. So those are some of the opportunities. I want to commend, though, that the fact that we've been working on this for now about 3 or 4 years, and finally we have an opportunity to move forward. And I think there's a lot of exciting possibilities for Lawrence and for Methuen to work together and to achieve things that have not been achieved before, and there's a dire need for it. And I'm happy to help out.
Okay, well, I know you have my support, and I believe I can speak for the board that you have our support. You know, we give you a strong endorsement.
Thank you.
With your knowledge base. We hope we can find a way to have you be a part of this training. With the Shared Services Grant, that seems like it's more important than ever.
Now, I'm still part of it, and I'm happy to supply my services and my collaboration with the City of Lawrence.
Okay, all right.
Thank you very much.
Thank you, Ethan, for everything we do. Could one of the ideas I have for this money that we're getting is to replace Citizen Serve because of the lack of informatics that we can do with the program. Could you give us some suggestions on possible programs to replace it? Because I know some of our inspectors have issues, and if our base program is not worth it because it was given to us by Columbia Gas.
Most often, shared scope of services include those kinds of things as well. For example, the infrastructure or the kinds of electronic systems that you would use, and also the state will provide some of that as well. But I have not yet seen that.
I just want to say that Citizen Serve wasn't given to us. It was purchased by Columbia Gas at the time. It was supposed to be for plumbing only. I worked on the system. I helped create it. It's a great system. It's just that people need to know how to use it. That's what the problem is. People don't know how to use it. They need to learn how to use it. So if people are telling you that they don't know how to use it, it's because they're not following instructions or doing the training and calling. They have the best customer service of any other one, and everything on there was created. And we had a task force, and I think the system is a great system. It works well, but you have to learn how to use the system.
Okay, so sorry, I've spoke to several of the ISD members, and I've tried to ask for like informatics, and they said they weren't able to do it. I mean, maybe I should have came to you, but they've expressed
in the
some
future, I would
frustration.
like for you to speak to me because I'm the director of the department, and I helped create the system back in when Columbia Gas was here, and just you could get any report you want. That's how I do my annual report. Everything's on there. All the, when there's code, compliance stuff, the food compliance stuff, everything's in there. If some inspectors are telling you that, they're wrong. And I'm gonna have a meeting, I'm gonna talk to them because they should be going out of ISD and saying that something's no good when they don't even know how to use it.
All right, we need to make a motion to adjourn. Do I have a motion?
You guys actually need to make a vote, to approve using the funds when they do it.
Okay. Can I have a motion to approve the intermunicipal agreement for public health excellence and shared services grant? I make a motion. I move to.
So I move to approve the intermunicipal agreement for the public health excellence for shared services between Lawrence and Methuen.
A second. All in favor? Aye. The motion passes, and that is the end of our,
Next board meeting.
the next board meeting will be Tuesday, the 11th, March 11th, Tuesday. Okay.
I'm not sure.
March 18th or March 11th?
I'll do the 11th and I'll let you know.
Okay. Tentatively, March 11th, and pending availability. Okay. Okay. Meeting's adjourned. Thank you for coming.